Regular human insulin. Detailed information. Introduction, trade names, Humulin R, Novolin R, Actrapid, and others. Other names, insulin injection, soluble. Neutral insulin, regular human insulin, regular, Toronto insulin, biosimilar, mixed-redlin. Regulatory data, ahs/drugs.com, monograph available, Medline Plus, reference A682611. License information, listed on US Daily Med as Humulin. Administration routes, subcutaneous, under the skin, intramuscular, into the muscle, intravenous, into the vein. Legal status, Canada, prescription only, United States, available as over-the-counter or prescription only. Mechanism of action. Pharmacokinetics, mimics natural insulin to help cells absorb glucose from the bloodstream. The onset of action begins within 30 minutes. The duration of action lasts for approximately 8 hours. Function. Facilitates glucose uptake by cells in muscles, fat, and liver. Inhibits glucose production by the liver. Side effects. Common side effects. Low blood sugar, hypoglycemia. Other side effects. Skin reactions or changes at injection sites. Low potassium levels, hypokalemia. Allergic reactions, for example, rash or itching. Contraindications. Absolute contraindications. Hypersensitivity or allergy to regular human insulin or any of its components. Relative contraindications. Extreme caution in patients with low blood sugar, hypoglycemia, or low potassium levels, hypokalemia. Drug use. Monotherapy or in combination. As monotherapy, regular human insulin can be used alone to manage blood glucose levels in patients with diabetes. As combination therapy, often combined with longer-acting insulins, such as NPH insulin, for better glycemic control. May also be combined with oral antidiabetic drugs in type 2 diabetes. Most suitable combination. Generics. NPH insulin, for example, Humulin 70/30ths, Novolin 70/30ths. Metformin to improve insulin sensitivity. DPP-4 inhibitors, for example, sitagliptin or vildagliptin. SGLT2 inhibitors, for example, empagliflozin or dapagliflozin. GLP-1 receptor agonists, for example, liraglutide. Most popular international brands containing regular insulin. Humulin R, manufacturer, Eli Lilly. Country, United States. Novolin R, manufacturer, Novo Nordisk. Country, Denmark. Actrapid, manufacturer, Novo Nordisk. Country, Denmark. Insumin, Rapid, manufacturer, Sanofi. Country, France. Mixed-redlin, manufacturer, Baxter Healthcare. Country, United States. Adverse events. Common. Adverse events, hypoglycemia, low blood sugar. Injection site reactions, redness, swelling, pain. Allergic reactions, for example, rash or itching. Hypokalemia, low potassium levels. Specific considerations, use with a meal. It is best to administer insulin before meals to prevent post-meal blood sugar spikes. Avoid skipping meals after insulin use to prevent hypoglycemia. On an empty stomach. Not recommended as it may lead to severe hypoglycemia. With specific foods, monitor carbohydrate intake as it directly influences blood sugar levels. Avoid high sugar or high fat meals that can alter the insulin's effectiveness. Alcohol consumption should be moderated as it may cause unpredictable blood sugar fluctuations. Drug interactions. Drugs that increase insulin effects, risk of hypoglycemia. Oral antidiabetic drugs, for example, metformin, sulfonylureas. Dipeptidyl peptidase 4, DPP-4, inhibitors, for example, sitagliptin. Glucagon-like peptide 1, GLP-1, receptor agonists, for example, liraglutide. Sodium glucose cotransporter 2, SGLT2, inhibitors, for example, dapagliflozin. Angiotensin converting enzyme, ACE inhibitors, for example, enalapril. Beta blockers, for example, propranolol, may mask signs of hypoglycemia. Monoamine oxidase inhibitors, MAOIs. Salicylates, for example, aspirin. Alcohol, drugs that decrease insulin effects, risk of hyperglycemia. Corticosteroids, for example, prednisone. Diuretics, for example, thiazides. Thyroid hormones, for example, levothyroxine. Sympathomimetics, for example, albuterol, epinephrine. Antipsychotics, for example, olanzapine. Oral contraceptives or hormonal therapies. Food interactions recommended practices. Administer insulin before meals to optimize blood sugar control. A balanced carbohydrate meal improves the drug's efficiency. Foods to avoid: High sugar foods may cause post-meal hyperglycemia. Alcohol can unpredictably affect blood glucose levels. Special notes. Consistent meal timing and portion size are crucial to prevent blood sugar fluctuations. Pharmacology class. Short-acting insulin analog. Source: human insulin, biosynthetic using recombinant DNA technology. Manufactured using Escherichia coli or modified pig insulin. Mechanism of action: mimics natural human insulin, promotes glucose uptake by cells in muscle, fat, and liver. Inhibits hepatic glucose production. Stimulates glycogen synthesis and storage. Inhibits lipolysis and protein breakdown. Pharmacodynamics. Onset of action. Begins in 30 minutes after injection. Peak effect. Observed within 2 to 4 hours. Duration of action. Lasts up to 8 hours. Action. Helps lower blood sugar by increasing glucose utilization and decreasing glucose production. Pharmacokinetics. Absorption. Rapidly absorbed when injected subcutaneously. Absorption rate depends on the injection site. For example, abdomen, arm, thigh. Distribution. Distributes throughout the extracellular fluid. Metabolism. Primarily metabolized in the liver and kidneys. Broken down by insulin-degrading enzymes. Excretion. Excreted via the kidneys. Half-life. Approximately 4 to 6 minutes, but effects last longer due to receptor binding. Maximum daily dose. General guideline. The dose varies based on individual needs, blood glucose levels, and physician recommendations. Typical range, type 1. Diabetes, usually 0.5 to 1.0 units per kilogram per day. Type 2. Diabetes, may require higher doses, ranging from 0.7 to 2.5 units per kilogram per day. Emergency situations, for example, diabetic ketoacidosis. Dose adjustments and continuous infusion may be required. Maximum safety. There is no absolute upper limit, but overdose risks include severe hypoglycemia and hypokalemia. Chemistry. Chemical formula C257, H383, N65, O77S6. Molar mass, approximately 5,807.57 grams per mole. Half-life, approximately 4 to 6 minutes. Biological activity lasts much longer due to receptor binding. Melting point, not well defined for proteins. Stable in solution at room temperature for short periods. Solubility, soluble in water at neutral pH. Forms clear solutions with zinc crystals for injections. Organic molecule class. Protein, polypeptide hormone. Bioavailability, nearly 100% when administered intravenously, reduced with subcutaneous administration due to slower absorption. References: book, title, Clinical Use of Insulin, Principles of Diabetes Mellitus, Country, USA, date, 2020. Findings: detailed the pharmacological properties and clinical management of insulin therapy. Website: name, World Health Organization, WHO, Essential Medicines, Country, Global, date, 2021. Findings: lists insulin as an essential medicine due to its critical role in diabetes management. Study, title, Comparative Effectiveness of Insulin Formulations. Country, Canada, date, 2018. Findings: regular insulin is effective for glycemic control in emergencies and routine diabetes management. Website, name, Daily Med, US FDA. Country, USA. Date, updated 2022. Findings: describes Humulin, R pharmacokinetics, indications, and usage. Study, title, Pharmacodynamics of Human Insulin. Country, UK. Date, 2017. Findings: highlights the predictable onset and duration of regular human insulin in glycemic management.